Ever walk past one of these machines and wondered what's really going on inside? Well, today we're going to pull back the curtain on the incredible tech of a modern CT scanner. We'll be using the Sequoia Inspiration 64 Plus as our guide to see exactly how engineers are making medical imaging faster, clearer, and way safer than ever before.
You know, when you really get down to it, a CT scanner is basically a puzzle solver, and the puzzle it's trying to solve is, well, seemingly impossible. How do you see every single tiny detail inside a person's body with incredible clarity without making a single cut? It's an amazing piece of technology designed to make the invisible visible.
So how on earth does it do that? Okay, imagine you have a loaf of bread. You want to see the texture of every slice, but you can't actually cut it. That's pretty much what a CT scanner does. It takes hundreds of X-ray pictures from all these different angles, and then a super powerful computer digitally stacks them into these impossibly thin slices. It gives doctors a complete 3D view of what's going on inside.
Now, for decades, designing a scanner like this involved a huge trade-off. Engineers and doctors were always caught in this tough balancing act, a problem that became known as the imaging trilemma.
First up, you need speed. I mean, think about it. The human body is never perfectly still. We're always breathing, our hearts are beating. So to get a clear picture and not just a blurry mess, the scans have to be incredibly fast. We're talking just a few seconds while you hold your breath.
Second, you need detail. And not just good detail, you need ultra-high-resolution detail. Doctors are looking for the tiniest little clues in these images, so they need astonishing precision to be able to make a confident, accurate diagnosis.
And third, and this one is the big one, you need safety. CT scanners use X-rays, right? So the number one priority, totally non-negotiable, is using the absolute lowest radiation dose possible to keep the patient safe.
And here was the problem, the fundamental challenge for so long. You could only pick two of those three things. Want a faster scan with more detail? Well, that usually meant you had to use a higher radiation dose. Want to lower the dose? Okay, but you might lose some of that crucial image quality. The entire goal of a modern scanner is to finally solve this trilemma, to deliver speed, detail, and safety, all at the same time.
So how did they crack the code? Well, the solution starts with the hardware itself, the actual physical engineering of the machine. Some really brilliant design choices are pushing the boundaries of what's even possible. Let's take a look.
Okay, let's pop the hood and take a quick tour inside this ring. This is called the gantry, and it's basically the heart of the whole machine. On one side, you've got the X-ray tube that creates the beam. Directly across from it, there's a super advanced detector. This whole setup spins around the patient at mind-boggling speed, collecting data from every possible angle.
Now, this chart shows you exactly how those tech specs actually make a difference in the real world. Check out that rotation speed, just 0.7 seconds for a full rotation. That's insane. That directly leads to faster scans, which means less time holding your breath. And look at the detector. It has almost 28,000 individual elements. It's just vacuuming up a huge amount of data with every spin, which is how you get that crystal clear detail. And a slice thickness of just over 0.3 millimeters? That's how you get those incredibly fine, detailed pictures we were talking about.
Another key piece of hardware is something called the 75-centimeter large bore. Now that sounds super technical, I know, but all it really means is that the opening, the tunnel, is wider and more open. This little design choice makes a huge difference, making the whole experience way more comfortable and less claustrophobic for patients.
But here's the thing, even the most amazing hardware in the world can only get you so far. The other half of the solution, the part that's maybe even more revolutionary, is the invisible intelligence running behind the scenes. This is where the software takes over, especially when it comes to making the scans safer.
One of the biggest breakthroughs is a technique called iterative reconstruction. Honestly, the best way to get your head around it is to think about the night mode on your phone's camera. You know how in low light it takes a bunch of shots and pieces them together to create one bright, clear picture? Well, the iDream algorithm does something very similar for CT scans. It can take the raw data from a low-dose scan and intelligently clean it up, getting rid of all the noise and making the image sharp and clear. And the result of that clever software? It's staggering. By using these smart algorithms to build a better picture from less information, this tech can potentially slash the patient's radiation dose by up to 63%. Let that sink in for a second. That is a massive leap forward for safety, and it directly attacks one of the core problems of that old trilemma. And it doesn't even stop there. The scanner comes packed with a whole toolkit of smart software. If a patient has a metal implant that could mess up the image, there's an algorithm for that. Worried about a little bit of patient motion? Yep, there's an algorithm for that too. There are even specialized low-dose settings for things like lung cancer screenings and, really importantly, for treating children. Every single one is another layer of intelligence working to get the best possible image at the lowest possible dose.
So, what happens when you combine this incredible hardware with all this intelligent software? You get a fundamental change in the quality of care, not just for the patients, but for the doctors who rely on these images.
For the patient, it just means a better, more comfortable experience. We're talking shorter breath holds, like a full lung and abdomen scan in just 16 seconds, and way less radiation. And for the doctor, it's all about confidence. This tech gives them images so clear that one report said they can restore real, previously unseen structures. That gives them so much more confidence in their diagnosis, plus they have powerful 3D and virtual tools to work with.
And this, right here, is what that partnership really looks like. On one side, you have the powerful, sophisticated machine quietly capturing all that data. And on the other, you have the medical expert using this incredibly complex software interface to turn that raw data into a life-saving diagnosis. It's the ultimate team-up between technology and human expertise. So the next time you see a CT scanner, you'll know it's so much more than just a machine. It's a finely tuned solution to that imaging trilemma, a beautiful blend of brilliant hardware and intelligent software that can finally deliver speed, detail, and safety all at once. And it just leaves you wondering, right? As this technology keeps making the invisible world more and more visible, what are the next great mysteries we're going to solve?